Hi everyone, today we'll discuss about MCQs on Achalasia cardia. So all are true statement about achalasia except we need to identify which is the false statement. It predisposes to malignancy is true. Body peristalsis is normal. No, it's a false statement because peristalsis movement is absent. So, and LES pressure is increased, that is true, and dilatation of proximal segment is because of inadequate relaxation of LES. So, this is also true. The correct answer is option B. All of the following are true about achalasia cardia except. So, we need to find out the false statement. Achalasia means absence of relaxation. This is true. Heller's myotomy is the true treatment of choice. It is nothing but dividing the circular muscle fibers of the lower esophagus and the cardia. It's a pre-malignant condition, it's true. It is caused by selective loss of stimulatory myotic neurons. No, it is inhibitory. So option D is correct. All are manometric features of achalasia cardia except. So whenever patient presents with achalasia cardia, so you do barium swallow followed by esophageal manometry. So gold standard investigation is manometry. So high LES pressure is seen. Decreased LES relaxation, yes. Segmental body peristalsis, there is no peristalsis, it is aperistaltic, so this is wrong. Manometry helps in diagnosis, yes. So option is C. A female patient has dysphagia, intermittent epigastric pain. On endoscopy, esophagus was dilated above and narrow at the bottom. So, female patient coming with dysphagia and intermittent pain and esophagus is dilated above and narrow. So, the diagnosis is achalasia cardia. So, the treatment is Heller's cardiomyotomy. So, in achalasia cardia, true is, so pressure at distal end is increased with no peristalsis, that is true. Low pressure at LES with no peristalsis, there is high pressure, so this is false. Pressure more than 50 millimeters mercury with peristalsis, there is no peristalsis, so this statement is false. Pressure at the distal end is increased with normal relaxation, there is no relaxation at the sphincter, so it is false. The only true statement is option A. Young patient presents with history of dysphagia more to liquids. A young patient with dysphagia more to liquids than solid. The first investigation is, it is achalasia cardia, so it is barium swallow. Treatment for achalasia associated with high rate of recurrence is botulinum toxin. So as long as you inject botulinum toxin, so the recurrence period becomes very short from one injection to another, and higher recurrence is seen with botulinum toxin. Increase difficulty in swallowing both for solid and liquid in a woman with bird beak appearance. So the classical barium swallow is bird beak appearance is seen in achalasia cardia. So in carcinoma you see apple core appearance, and these reflex esophagitis, Barrett's esophagus is always diagnosed on OGD, not on barium swallow. So a 30-year-old woman comes with dysphagia for both solid and liquid, and barium swallow shows parrot beak appearance. On esophageal manometry, LES pressure is increased. Management includes, and it's a PGI question, so multiple options can be correct. We give nitrates, yes. We give calcium channel blockers, yes. Botulinum toxin, yes. And Heller's cardiomyotomy. Heller's operation is done for achalasia cardia. The defect in achalasia cardia is present in myenteric plexus of Auerbach's. What is the diagnosis of barium esophagogram? So when you see this, you can make out there is a bird beak appearance of the lower esophagus. And there is dilatation of the upper part of the esophagus. So this is seen in achalasia cardia. Whereas hiatus hernia, you can see some part of the fundus in the barium swallow above the diaphragm. Whereas in diffuse esophageal spasm, you can see corkscrew appearance of the esophagus in the barium swallow. And reflux esophagitis, we don't diagnose with barium swallow. All about achalasia cardia are correct except mostly in women, true. Dilated esophagus narrowing to a point, true. Heller's operation is treatment of choice, yes. Not a premalignant condition, false. So it is a premalignant condition. So the correct answer is D. All are true about achalasia cardia except dysphagia is there, aspiration because of the fermented food particles in the esophagus. Mcqs test is hyposensitivity, no, it is sensitive. X-ray finding of dilated esophagus with an arrow and yes. So the option is C. Following are radiological evidence of achalasia cardia except. So there is smooth narrowing of esophagus. In malignancy there is an abrupt narrowing, and dilated tortuous esophagus, yes, in an advanced stage where you call as sigmoid esophagus. Absence of air in the fundus because of there is no relaxation of LES, so you don't find air in the fundus. And exaggerated peristalsis, there is absent peristalsis, so the option is D. Bird's beak appearance is seen in achalasia cardia. The characteristic appearance seen on the barium swallow is, you can see the classical bird beak appearance here, so it is achalasia cardia. The achalasia cardia is characterized by all except most common in women, yes. Dysphagia is the most common symptom, true. It's a pre-malignant condition, parrot beak is appearance is there. So if the option was most common in men, that would be the option. But here there is no correct option. True about achalasia cardia is all except on repeated Botox injection recurrence rate increases, that is true. More common in young women, yes. Surgery is the treatment of choice, yes. And it is a pre-malignant condition, so the statement is wrong. So option D is correct. Thank you.